Hello, good day. This session I'm going to cover alpha blockers. As you know, alpha blockers, it means these are the agents which blocks alpha receptors, namely alpha 1 and alpha 2. Let's first classify these alpha blockers. They're classified majorly into two groups. One is non-selective alpha blockers. These agents can block alpha 1 and alpha 2. They're not selective to any particular receptors. And in this, there are two important drugs. One is phenoxybenzaimine, which is the only non-competitive antagonist in adrenergic pharmacology. And as we say, non-competitive means it binds to the neighboring site and brings the permanent conformational change so that agonist cannot bind to it anymore. And hence, the duration of action of phenoxybenzaimine is much longer as compared to phentolamine, which is a competitive blocker. Hence, action of phentolamine is much shorter. It lasts around 4 to 6 hours. The second group of alpha blockers would be selective alpha 1 blocker. The selective alpha 1 blocker examples are prazosin, doxazosin, terazosin, and there's one particular drug known as tamsulosin, which is specific blockade to alpha 1A or C. And hence, the action of alpha 1A C blockade would be specific to prostate. And most of the alpha 1 blockers, to remember easily, they end in zosin or losin. Then we have selective alpha 2 inhibitors, which includes mirtazapine. Mirtazapine is primarily used as antidepressant. And the second would be yohimbine, which has limited clinical use, could be used in erectile dysfunction. Moving on to pharmacological effects of alpha blockers. Alpha blockers, as they block alpha 1 receptors in the blood vessels, and that would lead to vasodilatation and decrease in total peripheral resistance, and hence it would reduce blood pressure. Because of reduction in the blood pressure, body reacts by causing reflex tachycardia. The other effects of alpha 1 blockers would be it causes constriction of pupil by blocking alpha 1 in the dilator pupillae. It would cause decrease in the tone in the sphincter of urinary bladder, thereby relieving obstructive symptoms. In the GI tract, it could increase motility, and that's seen with alpha 2 blockade, whereas it could increase insulin secretion, that is again due to alpha 2 blockade. The last two pharmacological effects, that is GI effects and metabolic effects, is seen with non-selective alpha blockers only. Now, uses. As you know, phenoxybenzaimine is a non-competitive blocker, and hence it's very longer acting, and that's why it is preferred drug for medical treatment of pheochromocytoma. As you know that pheochromocytoma is an adrenal tumor releasing lot of epinephrine, and which is causing episodic increase in blood pressure. And this can be managed well with the help of phenoxybenzaimine. The second drug in its class, phentolamine, because of its short-acting nature, it is used for short-term control of blood pressure in pheochromocytoma and especially in intraoperative management. Another use of phentolamine is to prevent dermal necrosis caused by extravasation of alpha receptor agonist. So alpha receptor agonists like say epinephrine, norepinephrine or phenylephrine, if they accidentally go around the veins in the tissue, it can cause dermal necrosis. So if you give phentolamine in timely manner, can prevent dermal necrosis by vasodilating those blood vessels. Another use is it can be given as an intracavernosal injection for erectile dysfunction, and also can be used for hypertensive crisis. Hypertensive crisis especially seen with sudden stoppage of clonidine, called as clonidine withdrawal or rebound hypertension, and other reaction like wine and cheese reaction, which is seen with dietary products like wine and cheese which is consumed by a patient who is already on MAO inhibitors. can also lead to sudden surge in blood pressure. Whereas selective alpha-1 blockers have different uses. The major use of selective alpha-1 blockers would be essential hypertension. And it is one of the commonly used drug for treatment of hypertension, especially in mild to moderate, or we can say stage 1 hypertension. Another use is it can be used for congestive heart failure, where it can reduce both preload and afterload. It is one of the initial drugs used in the treatment of benign prostatic hyperplasia, where it can block alpha-1 receptor in the prostate and relieve the urinary obstructive symptoms like urgency, hesitancy. And it can also be used for vasospastic disorders like Raynaud's phenomenon, where it can dilate these blood vessels. Selective alpha-1 blockers are specially preferred when hypertension is associated with benign prostatic hypertrophy. If the patient has both, then this would be an excellent choice. And another good choice of alpha-1 blockers would be those patients who are having hypertension and also dyslipidemia. If their lipid profile is not good, alpha-1 blockers are supposed to improve this lipid profile, and hence it would be a choice of drug in that condition too. So what adverse effect you would expect with alpha blockers? Alpha blockers can cause hypotension because it reduces the total peripheral resistance and resulting in compensatory reflex tachycardia. One interesting side effect you would see with alpha-1 blockers is first dose effect or first dose phenomenon. First dose effect is nothing but when you give an initial dose and within 30 to 90 minutes patient can go into marked postural hypotension, that is marked decrease in blood pressure, especially when standing, and also can lead to syncope or syncope. And with this effect, we have to be very careful with patients who are going to start on alpha-1 blockers, and hence here are some strategies which can be taken to prevent first dose effect. One thing would be start with a low dose, and second would be preferably taken at the bedtime, and that could prevent this first dose effect. Other side effects would be impaired ejaculation, and peptic ulcer is usually seen with phentolamine. So with this, I would like to conclude this session of alpha-1 blockers, and the next session I would be talking more about beta blockers. And please keep listening to me and subscribe my YouTube channel. Thank you.